Often, when people talk about mental health or mental flourishing, they're referring to individuals, how individual people are functioning mentally, or whether they have a mental illness or a diagnosis. But mental health is not just about an individual's experience. First, families and whole communities can experience stressors in life, and as a result, they can experience struggle or success as a group. For example, a family that has been through a financial struggle, domestic violence, or homelessness may experience more stress as a family unit. And similarly, a community that has experienced economic hardship, discrimination, or the trauma of war may face increased community-level stress. These situations can influence whether whole groups of people flourish or not. And second, the mental health or mental flourishing of an individual is dependent on many influences that are far beyond their own daily lives or their individual control. Our mental flourishing is not based on simply our own grit or ability to overcome obstacles. It's affected by our genetics, our physical health, our relationships with family or friends, our family's health and functioning, our communities and the organizations within them, our local and national policies, and our society, and whether it supports or creates challenges to our mental flourishing. Your mental health ebbs and flows based on the interaction of all these factors. The more these interactions add up to positive influences, the more likely you will flourish. An ecological approach to mental flourishing considers whole populations of people. We can work to strengthen our policies, systems, communities, and families in order to promote mental flourishing for everyone, not just for one individual at a time. An ecological approach also promotes healthy environments. We can create mentally healthy environments by paying attention to risk and protective factors at each level of this model. Programs that support strong families, create equitable access to the basic needs of life, and improve safety for everyone change the environment, which then changes the behaviors of the people who live there. These types of programs help people have more control over their lives, including their mental health. This model shows many influences on an individual's mental health. It reflects an introduction to the research that identifies risks at every level of this model, as far-ranging as technology, social connections, poverty, resource allocation, media messages, and government investment of resources. All of these have an effect on an individual's mental flourishing. By changing these risk factors, we can change mental flourishing for whole groups of people. To learn more about this model and related research, or more information about mental health and mental flourishing, click the links in the description below.